Before starting our case, let's talk about the parts of the lateral ventricle as well as the parts of the corpus callosum on CT scan. Starting from the superior cuts, the first part to appear of the lateral ventricle is the body of the lateral ventricle. So these are the bodies of the lateral ventricle. Then this is the occipital horn of the lateral ventricle, the frontal horns of the lateral ventricle, and the trigone or the atrium of the lateral ventricle. And the last part is the temporal horn. These are the temporal horns of the lateral ventricle. Now let's talk about the parts of the corpus callosum on CT scan. The most superior part of the corpus callosum to appear on the superior cuts is the body of the corpus callosum, and is seen between the bodies of the lateral ventricle. So on the superior cuts, the first part of the corpus callosum to appear is the body, and the first part of the lateral ventricle to appear is the body of the lateral ventricle. Then the geno of the corpus callosum is seen between the frontal horns of the lateral ventricles, and the splenium of the corpus callosum is seen posteriorly to the occipital horns of the lateral ventricle. So here,
Hi, Mother.
the body of the body of the corpus callosum is seen at the level of the bodies of the lateral ventricles. And if you go down, this is the splenium of the corpus callosum seen posterior to the occipital horns of the lateral ventricle. And this is the geno of the corpus callosum seen anteriorly to the frontal horns of the lateral ventricle. So this is our case, okay? Let's see the first part to appear. So this is the body of the corpus callosum is seen between the bodies of the lateral ventricle, okay? The body of the corpus callosum seen between the bodies of the lateral ventricle. The body of the corpus callosum. And if you go, this is the geno of the corpus callosum, and this is the splenium of the corpus callosum. So the first part of the lateral ventricle to be seen starting from the superior cuts of the brain is the body of the lateral ventricle. So these are the bodies of the lateral ventricle, and the connecting white matter fibers in between is the body of the corpus callosum. As you know, the corpus callosum is made of white matter fibers connecting the two cerebral hemispheres. So the white matter fibers connecting the two cerebral hemispheres at the level of the bodies of the lateral ventricle is the body of the corpus callosum. The body of the corpus callosum, the bodies of the lateral ventricle. The two frontal horns of the lateral ventricle will be seen at this level, and the two occipital horns of the lateral ventricle. The white matter fibers, the white matter connecting fibers here is the genome of the corpus callosum, okay, anterior to the frontal horns of the lateral ventricle. The white matter connecting fibers here, posterior to the occipital horns of the lateral ventricle, is the splenium of the corpus callosum. Then if you go down, this is the atrium of the lateral ventricle, and the last part of the lateral ventricle, the temporal horn of the lateral ventricle. So let's talk about our case. 60-year-old male with worsening daily headaches. The pre-contrast CT scan, this is the pre-contrast CT scan, showed nodular hyperdense lesions seen along the body of the corpus callosum. So this is the pre-contrast CT scan. Can you see the nodular hyperdense lesions along the body of the corpus callosum? If you go down, nodular hyperdense lesion seen along the body of the corpus callosum. These nodular hyperdense lesion will be seen reaching into the right frontal horn and the foramen of Monro. Still in the body of the corpus callosum. Now, this nodular hyperdense lesion is seen reaching into the right frontal horn of the lateral ventricle and the foramen of Monro. As you know, the foramen of Monro is the connection between the frontal horn of the lateral ventricle and the third ventricle. So these lesions are seen reaching into the right frontal horn and the foramen of Monro. We also need to talk about the brain lobes on CT scan. In the most superior cuts of CT scan, only the frontal lobe will start to appear. So this is the frontal lobe, okay? When you go down at the level of the centrum semi-ovale, the centrum semi-ovale is the white matter fibers that is seen just above the level of the lateral ventricle, the bodies of the lateral ventricle, and the corpus callosum. So the white matter fibers just above the bodies of the lateral ventricle and the body of the corpus callosum is the centrum semi-ovale. At this level, this is the central sulcus. This is the central sulcus. The anterior two-thirds of the brain is formed by the frontal lobe. The posterior one-third is formed by the parietal lobe. So at the level of the centrum semi-ovale, the frontal lobe is the anterior two-thirds. The parietal lobe is the posterior one-third. When you go down, at the level of the bodies of the lateral ventricle and the body of the corpus callosum, okay, the anterior half of the brain is formed by the frontal lobe. and the posterior half of the brain is formed by the parietal lobe. So at the level of the bodies of the lateral ventricle, the anterior half is the frontal lobe, the posterior half is the parietal lobe. This is the same level, the bodies of the lateral ventricle. If you go down, at the level of the sylvian fissure and the parieto-occipital fissure, when you see the sylvian fissure and the parieto-occipital fissure, the frontal lobe is seen anterior to the sylvian fissure, okay? And this is the temporal lobe. So this is the frontal lobe anterior to the sylvian fissure. This is the temporal lobe posterior to the sylvian fissure. And this part or this lobe is the parietal lobe and the occipital lobe. Parietal lobe and occipital lobe, and this is the parieto-occipital fissure. As long as you see the sylvian fissure, there is also a parieto-occipital fissure here. So this is the frontal, the temporal, the parietal, the occipital. This is the same level, sylvian fissure, parieto-occipital, parieto-occipital fissure. When you go down, there is no sylvian fissure here, so this part of the brain is only formed by the temporal lobe and occipital lobe. Temporal and occipital lobe. Okay, I think this is the last part. Yeah. So let's start to apply this information in our case. There are areas of associated vasogenic white matter edema in the right frontal lobe. Okay. So starting from the most superior cuts. Okay, this is the frontal lobe. Can you see? This is an area of white matter vasogenic edema in the right frontal lobe. Okay, when you go down, this is the centrum semi-ovale. So here, this is the central sulcus, the anterior two-third. The anterior two-third is the frontal, the posterior one-third is the parietal. So here, the area of white matter vasogenic edema is seen in the frontal lobe as well as the right parietal lobe, in the right frontal and right parietal lobe. If you go down, still the centrum semi-ovale. As I mentioned, the centrum semi-ovale is the white matter seen just above the level of the bodies of the lateral ventricle and the body of the corpus callosum. So here there is an area of white matter vasogenic edema in the right parietal lobe. The posterior one-third is formed here at the level of the centrum semi-ovale. The posterior one-third is the right parietal lobe. At the level of the bodies, of the lateral ventricle, the anterior half is formed by the frontal lobe and the posterior half is formed by the parietal. So here, this is the frontal lobe and this is the parietal lobe. This area of vasogenic white matter edema is seen in the right parietal lobe. Still the right parietal lobe. Okay, right parietal lobe. We are still at the level of the bodies of the lateral ventricle. Now, this is the occipital horn of the lateral ventricle, and this is the frontal horn. At this level, you will see all brain loops. All the brain loops will be seen at this level, okay? the frontal, the temporal, the parietal, and the occipital. The white matter pathogenic edema here is seen at the right occipital lobe. Still in the right occipital lobe. Okay. So the areas of associated vasogenic white matter edema in the right frontal, parietal, and occipital lobe. These white matter areas of vasogenic edema are suspicious for further parenchymal deposits, which can't be seen on the pre-contrast CT scan. So let's see these areas in the post-contrast CT scan. These white matter areas, okay, of vasogenic edema. Can you see this? This is the post-contrast CT scan. Can you see these lesions? There are further enhancing lesions seen in the suspicious white matter areas of vasogenic edema. There are further enhancing lesions seen in the previously mentioned or previously described white matter areas of vasogenic edema. And these enhancing lesions couldn't be detected on the pre-contrast CT scan. Also, the previously described hyperdense lesions in the pre-contrast CT scan, the previously described hyperdense lesions seen along the body of the corpus callosum, these lesions also show peripheral enhancement. So the lesions seen in the pre-contrast CT scan along the body of the corpus callosum showing here peripheral enhancement. Okay. These lesions are also seen in contiguous with an irregular enhancing nodular ependymal lesions seen within the right ventricle. These lesions seen along the body of the corpus callosum and reaching the right ventricle and the foramen of Monroe are seen on the post-contrast CT scan in contiguous with enhancing ependymal nodules seen along the right lateral ventricle. So the interpretation here, this is an infiltrative tumor of the corpus callosum and the white matter of the right cerebral hemisphere. The diagnosis regarding the distribution of the lesion involving the corpus callosum, okay, along with the hyper attenuation on the pre-contrast CT scan and the post-contrast enhancement, the most likely diagnosis is CNS lymphoma. However, other primary brain tumors such as glioblastoma multiforme, should be considered. This is an example of corpus callosum lymphoma, and this is an example of glioblastoma multiforme of the corpus callosum. This is the pre-contrast CT scan showing hyperdense lesion or hyperdense mass involving the splenium of the corpus callosum. Okay, this is an example of corpus callosum lymphoma. However, here there is a large heterogeneous mass involving the corpus callosum and crossing the midline to involve the both frontal lobes with central necrosis and peripheral enhancement, giving the characteristic butterfly glioblastoma multiforme. Management here. This patient needs more radiological investigations, needs MRI of the brain to correlate these lesions. So this is the sagittal gadolinium enhanced T1 weighted MRI of the brain showing the nodular enhancing lesions involving the body of the corpus callosum. This is the corpus callosum. And these are the nodular enhancing lesions involving the body of the corpus callosum. And the periventricular white matter nodular enhancing lesions are also seen here, along with the ependymal enhancing lesions in the right lateral ventricle. These are also the periventricular white matter nodular enhancing lesions. Here, the corpus callosum enhancing nodular lesions. This patient also needs more radiological investigations to assess the stage of this lymphoma. He needs CT scan of the chest, abdomen, and the pelvis for full assessment of the lymphoma staging, along with urgent neurosurgical referral. That's it.